Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Thank you to our platform sponsor, J&J, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content. The PHA is deeply saddened by news of catastrophic flooding in Texas in July 2025. This episode mentions flooding and other weather-related emergencies in a general sense, but was recorded before the 2025 Texas floods. Hi, my name is Angela, and welcome to this episode of PH Insights. Today, we're diving into an important and relevant topic right now, emergency preparedness. Whether it's a power outage, weather emergency, or medical crisis, being ready can make all the difference for those living with a chronic illness, specifically pulmonary hypertension, and their families. We have two very important guests joining me today. I'll give them a moment to introduce themselves. I'll first start with you, Elise.
Hi, welcome everyone. My name is Elise Whalen. I am a pediatric nurse practitioner at Texas Children's Hospital in Houston, Texas.
Thank you, Elise. So great to have you here today. And Jess, if you could take a moment to introduce yourself.
Hi there. Thanks, Angela, for having us on the podcast today. My name's Jess, and I am a nurse practitioner at Children's Hospital Colorado in the Heart Institute on the pulmonary hypertension team.
Perfect. Jess and Elise, along with their colleague Julie, presented a similar presentation for our conference attendees, and it was so well received. We really wanted to have this to go out on our podcast just to make sure everyone is prepared for any emergency they may face. And so we know emergencies come in many forms. There's hurricanes. We're in hurricane season right now. There's flooding, wildfires, snowstorms, tornadoes, just to name a few. And if you're living with a chronic illness like pulmonary hypertension, these situations pose additional health risks. So today we're here to discuss what you should know and to do to prepare for the next time you're facing an emergency. And so without any delay, I really would like to get right into the discussion and conversation. Just based on what we've already mentioned here, what are some other natural disasters or emergencies patients should be prepared for based on where they live?
I'll go ahead and take this question. So patients living in different parts of the country should really be prepared and aware for specific regional emergencies. And I think it's important to know this in a few different areas. So for one, knowing the area that you may be traveling to. So for instance, if you travel a long distance to see your PH care team, think about what are some potential disasters, so some potential weather things or anything that could come up as I'm traveling to this place. We also have a lot of patients that travel, maybe they travel internationally, or maybe they travel, like I said, to different parts of the country. So starting with different parts of the United States. So in the southern states, we commonly see things like hurricanes, tornadoes, flooding. And so it's important to think about what would be our plan for evacuation, finding shelter, specifically in the case of flooding, which can often occur, especially after hurricanes, having lived through Hurricane Harvey a few years ago myself. In the West Coast, we think a lot about earthquakes. These can disrupt power lines, aka electricity, roads, communication. And so we have to think about backup plans for these. Oxygen, medication needs. How are my medications going to reach me if the roads are a mess? And then going into the Midwest and northern states. So we would think about winter storms, blizzards, which do pose significant threats. And then they can also cause power outages. And then you really think about the rural areas as well. Eastern states, we have coastal flooding. There are hurricanes, which do occur similar to the South. And then you also think about wildfires, which I think you could also think about wildfires sprinkled in several of the regions already mentioned.
How do these emergencies uniquely affect those with PH?
So I think there's a lot of things that we have to think about for somebody who does have pulmonary hypertension, that this is what makes this episode today a little bit different than the standard disaster awareness, disaster preparedness, the podcast, or maybe just whatever you may read online. So we have to think about a few things. So for one, power outages or equipment failure during a storm can cut off access to oxygen, pumps for medication, which can in turn lead to pretty life-threatening situations. tornadoes, earthquakes. With Harvey, I think Hurricane Harvey that happened a few years ago, we weren't hit head on, but then that also included flooding, and then you're stuck. But these things can cause sudden evacuations. It can disrupt essential care. So first responders may have difficulty in reaching you. And I think we saw that a lot. We had evacuations on the highway. We had people being evacuated from the rooftops of their homes. That's never a situation that you want to be in. And so these events can cause patients to really be stranded and not have access to their healthcare teams. And then with things like floods or snowstorms, which I know Jess will talk about, it can be difficult to actually reach the hospital. And so this could, if you're out of oxygen, or if you're unable to plug in like a ventilator, for instance, because you don't have electricity, I think these are all things that we really have to think about ahead of time so that we're not in situations where we're having to scramble.
Yeah, absolutely. Just thinking about too, if there's weather and you get stranded in the car or anything like that, and we'll talk a little bit about how you can be better prepared with travel. But certainly with winter storms, getting stuck in them all of a sudden, maybe you didn't think the storm was as bad as you thought it was, or getting trapped somewhere and maybe not having your supply. So unfortunately, with our patients, those are things that we would encourage you to think about just so you're well prepared and you're not having to have an emergency on top of an emergency as well.
And I think that makes a great transition to this preparedness conversation about an emergency kit and why that's smart to have. It's not just a kit, it's essential for care continuity. So, what are some must have items that someone should have in an emergency kit, especially if they have PH?
Yeah, I'll talk a little bit about that. So I think first and foremost, we really emphasize being prepared and thinking ahead. And I think at most places, at least across the pediatric centers and pulmonary hypertension, we always encourage patients in general to have at least 7 days worth of medication on hand and ordering at that point. So I think especially if you're getting ready to travel or you know that there's an incoming storm of some sort, we're anticipating that of really staying on top of things and trying to get whether that's extra medication supplies or having extra oxygen tanks on hand. If you are oxygen dependent, do you need to think about having a generator at your home for snowstorms or other times where there might be power outages like flooding? Those are some simple things, well, not so simple, but some simple ways that you could try to be prepared ahead of time. So really making sure that you have your essentials on hand, including your medications, and have a way to get power if it is out for an extended period of time. I've never lived in an area with hurricanes, but I know sometimes you have no idea how long sometimes power will be out. And I know that you can try to register locally as well. I think it's called the Power Saver program in most places, looking in your local area, searching so you can sign up hopefully for them to try and reestablish power in your local area first, knowing that there's someone that has a medical necessity for power, for oxygen, for a ventilator, whatever it might be. And then certainly if you're on some of our more advanced therapies, of making sure you have backup pump, batteries, supplies, medications, and make sure you have a good way to store those as well so that they don't get contaminated is also a good thing. If you do get caught, we would encourage people to have documentation of some sort, whether that's a medical alert bracelet. Nowadays, they have a nice QR code that anyone can scan and see what medications you're on and who to contact in case of an emergency, whether that be your emergency contact or your provider team, and other things as simple as having water, having some non-perishable food items. Those are important things that are important for everyone, but especially for our patients with PH who will likely be more sensitive to not having adequate food and water for a time period. When traveling in the car, I think that's another time to be conscientious of what should I bring with me in the car. So certainly we would encourage you to bring your meds with you, even if you're going for a 3-day trip or something like that. I wouldn't bring just 3 days worth of meds. I'd bring at least your whole week's supply, or even bring your whole bottle or all of your backup meds with you. Certainly for traveling in the wintertime, whether you're living in the mountains of Colorado or you're living in the Midwest where they do get snowstorms, or in the East Coast, they can get really bad snowstorms, as well as making sure you have all those things like water, adequate tires, blankets, things like that in your car, especially if you know that you're going to be traveling in some snow. Anything else you wanted to add, at least to that, for preparedness? I know that was quite a long list.
Yeah, I think that captured a lot of the essential items. I think maybe if you're on oxygen, you can think about having extra tanks available, making sure that they're full. If you have a like a portable oxygen concentrator, thinking about, I know you talked about batteries for like your prostacyclin pumps, but maybe backup batteries for your portable oxygen concentrator, tubing, that kind of thing. I know in pediatrics, we often have a lot of kids on like formula feeds. So thinking about, you think about the non-perishable items, but do I need to make sure that I have a lot of extra formula on hand just in case? And then, I don't know, I think I worry a lot about people having phones that are charged to be able to do a QR. So maybe having like an actual paper written list of, here are my healthcare provider teams. This is how I contact them. These are like my key emergency contacts for my family, caregivers, that kind of thing might be really nice too.
Absolutely.
How can families build out a plan for communication when there is an emergency?
I mean, I think there's a couple of things that we can do. So, for one, as you sit down and talk, and I think for me, we think about it in terms of the child, parent, sibling kind of group, but then you also think about it in terms of an adult caregiver kind of group. I think there's different things, but I think one of the biggest thing is having a safe place. So, where would we meet if the phone lines were down or we weren't able to connect via the internet or something like that? So, maybe having a prearranged meeting spot to know, okay, this is where we're going to go if a tree comes down and hits our house, or what are we going to do? Having a plan. The other thing is text messages do sometimes go through versus calls, especially when there's a network overload. So thinking about, okay, what are some other ways that I could contact you if something did happen? And then ahead of time, sharing contacts who may live in unaffected areas who could help relay messages. So linking in people who are directly in the place where the emergency is, kind of keep them in the loop as well, so they can also help if there are any issues too.
Are there any other documents that families should have collected and ready to go as they begin, maybe to evacuate, shelter in place, whatever that may be for them?
So I think there's a few things that would be helpful. So for one, I know at least in our world, we rely a lot on use of patient access portals, which require the internet. So we can quickly pull up maybe a copy of like our medication list, or we know how to contact the provider team through the patient access portal, but you can't do that in an emergency. And then you also have to think that maybe the people you're trying to contact, they may also not have power in the situation. So I think having actual like a paper copy of your most active medication list, you could consider maybe having like your last progress note, like this is what we're doing, this is what we're worried about, because it also usually details like what your saturations are. So if you're in a situation where somebody who's just coming up and trying to figure out what's going on, having a good sense of this is where I am health wise is really helpful. And then I think the insurance information is also nice. I think most people do have like cards, but actually having access to those cards is helpful. I have a lot of families where we ask for insurance and they have to like go online and search for their card or call somebody. And it's nice if you have it in front of you, a way that you can access your information for that. And then advanced directives. So do you have any advanced directives? These are all of these documents are great if they're stored in like a waterproof container, that like something that would not get interfered with if it were to get wet in the event of a water related event.
Yeah, and to add to what Alicia said, I think an emergency where you're stressed because you're displaced or you're worried about other family members or your home, whatever it might be, to recall all of your information can be quite difficult. So having paper copies is an easy way for whomever you're working with or for you to look up to remember things is nice as well.
Yeah, I agree. We rely on technology and it's definitely very convenient. But I know even just myself when I'm at doctor's appointments or if it's a new doctor, it's like, what's your insurance? I have to scramble and look for it because it's on my phone. So having those paper copies will actually come in handy. I think that's a great and important tip. We did briefly talk about evacuating and creating that plan. What should be considered when you are choosing an evacuation route or an emergency shelter?
Yeah. I mean, I think the question that comes up a lot, especially for us in Texas, we get a lot of questions when we know a hurricane is brewing in the Gulf. We wonder, should we evacuate? Should we not? And our recommendations are generally, when we think about if you were stuck, how would that go for this patient? If there was an event where the patient had a crisis and you needed emergency personnel to get to them. So we put in like a risk stratification type perspective. And we usually do advise that they do evacuate because we don't want to put anybody in that situation where the patient, which is a child, could have a bad event and there is delays in them actually getting care. And so if they are high risk in that way, we actually do advise that they evacuate to a place that is likely not going to be affected by the emergency. But I think as they're evacuating, you have to think about they're going to a place that isn't going to have maybe the oxygen and all the things that they may be. So, we think about, for one, accessibility of the place they're going to. Can the place accommodate maybe medical devices? If a patient needs to be in a wheelchair, is that going to be a wheelchair accessible type place? Where is the place they're going? How close is it to medical care? So is there a hospital or a clinic or somewhere that has some kind of knowledge of pulmonary hypertension? Is that available? And I think that kind of also lends into whenever you travel, what would I do if I needed to seek inpatient care? Oxygen supply. So I think most places that are not affected by some kind of emergency would have electricity, but making sure that there is consistent electricity, especially if you go somewhere rural, or a backup power. So that way you can ensure that oxygen is continued to be available.
Yeah, and I just wanted to add, just with forest fires, and that certainly can dictate how you get out of wherever you might be living. Out west, we get those every year, and sometimes the forest fires are states away, and we have a lot of smoke, and sometimes they're very close. And so I think also with flooding and hurricanes, are there road closures? If you can look ahead of time to know, do you need to take an alternate route? For those people that are in the mountains or somewhere where they might be needing to go to higher elevation, possibly, to, even if it's just to drive over, do I need to be on oxygen for that? Or can I avoid going to higher elevation to avoid fires or whatnot, mudslides, whatever it might be? So I think thinking about road closures is also important before you just go. Has the area you might be driving through been affected already by the storm that passed through or the event that passed through?
And it's important to think through also if you have or don't have access to transportation when the first call comes out for evacuation. You want to be mindful if that transportation will transport also your medical equipment that's needed to that shelter. The shelter is accessible. So those are really great points to note. I'm looking here at some of the questions we've already planned and discussed what we wanted to talk about today. We're talking about evacuation, but I wanted to talk about the role that the healthcare team does play with assistant patients and what that looks like. Maybe some people have protocols in place and maybe some institutions don't. So how does the PH care team help in creating a plan or helping with patients during these emergencies?
I think this question is one, I was thinking about what I might say is, I think living in Houston, I've been in Houston for about 10 years, and I think we've had a lot of different emergencies. We've had COVID, we've had hurricanes, we've had flooding, we've had so many different things. And I would say that each time we've had some kind of event, our response and our approach to helping patients get through them has changed and improved. And so your medical team may not have this well drawn out, beautiful emergency plan, but I think that also comes with experience and with time. These are all things that we've learned along the way, that whenever we know that there is some kind of storm, we end up sending them a big blast. But basically, we send all of our patients a notice like, hey, we are aware of a storm that's happening. And we send a reminder, because I think if it's not happening today, you may not think I need a plan now for it. And so we try to put it on their radar. And a lot of times we have kids who will come to clinic to see us and they're not coming from the Houston area. And so they'll come a day before and we're like, actually, we're going to have to change all of our in-person clinics to video because we can't get in to see you. And so it is confusing a lot for families that aren't from Houston, and they're just like, oh, well, I'll just come. But it may not be the safest thing for the patient to actually be in a place that's having some kind of weather-related event or something like that. So I think there's a couple things. So I think that, for one, it's the team. So it's the team that includes your PH team, all the different specialists that are involved in the team, but it also includes the patient. It includes the caregiver, includes the family, to put together a nice plan based on kind of whatever's going on. And so that also includes, Angela, what you were saying, like thinking about transportation and is there somebody that can come help you? So we have to kind of know where you are and what your needs are so that way we can help you get to where you need to be in the safest situation possible. So for one, we can help you with medical documentation. So if there's any prescriptions that we need to send ahead of time, anything that we can do if you need like an inhaler sent or something that you may not have thought about. For instance, you may have really reactive airways. So we might need to send some albuterol that you haven't used, but we know with the storm or with wildfires, it may really irritate your airways. And so thinking ahead of time for that, oxygen requirements, a lot of times we will send in orders for portable oxygen. Like for instance, if you're traveling to a place that has higher altitude or you're flying, and so do we need to send oxygen ahead of time and having that planned before the weather event happens, that kind of thing. And then medication alternatives. So a lot of times where there may be a storm somewhere else in another part of the country, and then it disrupts shipment of those medicines to the patient where they are. And are there things that we can, offer this patient that will still provide the medication similarity, but may not be the actual medicine they're taking? So that's a conversation that we may need to have at that time. And then the other thing might be coordinating with local hospitals. So we have a lot of patients in Louisiana, for instance, and so we may have a hurricane that could be hitting Louisiana. And so we have to think about, okay, well, if there's a hurricane that hits wherever they are in Louisiana and they don't have power and they are oxygen dependent, how do I get them, or ventilator dependent? How do I coordinate with the hospital to admit them who have power? So thinking all about it collectively because there's so many variables there.
Yeah, I think that was a very thorough, Elise. I think the big thing is supporting and educating the family. It's really what all of that encompasses. And I think the only thing I wanted to add was that sometimes when we're having weather things that are hitting directly at our center, we are sometimes having to cancel appointments for patients for their safety, getting to and from, as Elise said, a lot of times our PH centers are servicing a larger area and patients are traveling from different areas, sometimes long ways, hours, whether it's a plane or a drive. And so I think being patient with us if we do have to cancel or want to reschedule for patient safety or for travel and everything as well.
Yeah, patience is very important during any emergency. Patience and grace for yourself, but also for the providers who are assisting, because they may be shelter in place in the center. So patience is very important here. I know often that some people can't even afford their medication outright, let alone an additional supply. So I would like to make a note that the PAN Foundation has immediate financial assistance available for patients with pulmonary hypertension and with any type of health insurance. Patients may qualify for up to $8,000 a year in financial assistance for medication costs. Patients, caregivers, or healthcare providers can apply today at panfoundation.org. And if you're a provider in a PH community, you can visit panfoundation.org to request custom training on enrolling patients. PAN is here to help. So if you need assistance to pay for your medications, the PAN Foundation is where we would like you to reach out to for financial assistance. Going back to our conversation here, we know the role that the care teams play and how you are there to support your patients, their families. How is that coordination important in staying prepared and having your patients stay prepared during an emergency?
Certainly, we're thinking about all of our patients, but especially at larger centers, we have a lot of patients. And obviously, we absolutely care and want to do everything we can to assist you. So I think communicating with your care team as when you can, obviously, as we've talked about a lot already, is that sometimes communication is cut for various reasons. And I think if you are struggling or you're not sure what to do, please reach out to us because our individual hospitals might be able to have some support if something like the PAN Foundation or if a state of emergency hasn't been called in the state. And so there's limitations in what might be funded from a state or federal level, which we know is an evolving situation as well. So I think please contact us. We're never going to be mad that you reached out because you're struggling. We're going to try our best to help you. But if you don't let us know, then we're not mind readers. And so we want you to reach out out to us and communicate with us and let us know what you're struggling with. And we'll absolutely do our best to try and connect you with someone, whether that's getting meds or figuring out how to get oxygen, or as Elise already mentioned, coordinating with a local hospital to get you admitted for assistance while we're working on getting you the proper supplies to be safe.
So if you are on oxygen or you are stabilized at home, but you have additional equipment that you need, if it's known that there will be severe power outages, you can work with the local hospital in that patient to have them admitted so they have continuous care, continuous power for their equipment.
Last year, we admitted a number of kids. We had a hurricane around this time in July of 2024 last year. We had several kids that were admitted just because they needed power to power their vent or get oxygen. I feel like every disaster we do have several patients who are admitted for that reason. If the patient has oxygen, if they're oxygen dependent, if they're ventilator dependent, and they have no way of supplying their vent with electricity or having continuous oxygen available, that's a pretty quick, you need to go to the hospital to have access to that. I think there's a couple opportunities though. I think the podcast today is to know the importance of prevention. And if you know there's a hurricane coming, you have limited oxygen supplies, or like for us here in Houston, we seem to lose power quite a bit. We had a really bad ice storm a few years ago and people were out of power for a long time. And I think in those situations, we're very sensitive to okay, our power's going out. So for our patients, if you know that you traditionally are out of power for almost every storm and you need oxygen or you have a ventilator that requires electricity, I think especially in that situation, evacuation ahead of time just to avoid having to go to the hospital for oxygen or electricity is great. I think that's my ideal planning.
Certainly, all of us want to keep our patients out of the hospital as much as possible. That's the goal of therapy and everything. So, to Lisa's point, being prepared and avoiding a hospitalization when our patients spend a lot of time at the hospital and at appointments is always ideal.
And Jess, you previously mentioned the changing landscape of things happening in our country right now. We know that regulations and insurance could either help some cases or hinder in others during a crisis. What policies can help ensure continuity of care for those with PH during emergencies?
Yeah, so I think as you mentioned earlier, the PAN Foundation, there are resources out there. We know that we're not really sure right now what's going to happen with FEMA over the next months to years. And so I think it's important to really look at your state and even your town to see if they have specific funding. Has the governor of the state declared a state of emergency, which kind of opens up some funding. So I think obviously there are things out there, but you're going to have to do some research of your own and advocate for yourself or for your child regarding trying to find those services. And sometimes with insurance, depending on what kind of insurance you have, which is sometimes hard to navigate, reaching out to maybe a care coordinator or a direct person with your insurance to see if there's ways that in which they can help in emergency situations, specifically if meds get damaged, can they do an early fill or help to navigate that kind of situation in times where there's things that really are out of your control and trying to get your medications and make sure you're avoiding hospitalization, which can be costly, obviously, to insurance. So I think really with things changing is looking up when you move to a new area or that's your first disaster in the area, finding what state resources there are, and then looking at foundations like the PAN Foundation, or sometimes even through your hospital, there are also ways in which they can assist displaced families as well.
I think, again, just to reinforce checking in locally, what's happening in your city, your state. It may be completely different than what's happening in a different state. So you want to make sure you have the information that is relevant for yourself. Connected to that, I know we mentioned technology already and some of the challenges, especially if you lose power. But are there any tools or any way that maybe even telemedicine can help patients and caregivers during this time?
I know the American Red Cross has an emergency app that does provide up-to-date alerts and has some emergency instructions based on where you are. Of course, that assumes that you do have electricity and a phone that's charged and things like that. That is a nice option. And then MediSafe, this also, I know when we presented this at the PHA conference, MediSafe was one that a lot of patients had used and recommended, and it's a medication reminder app that helps patients stay on track with their medications, especially when they're stressed and times are off and things like that. So it helps keep track of where things are. I think telemedicine is great. I think it allows us to, as care team members, to reach the patient from their home, and it removes travel, road safety, all of that out of the question. Last year when we had our hurricane, I had evacuated outside of the Houston area, and I was the only team member who had access to electricity. And so I was doing telemedicine visits to patients who were in Houston, and a lot of them didn't have power. And I think it was great to just make sure that they had everything they need, that I need to send any refills. But the problem I encountered was that I know that I need to send a refill, or I know that you need this medication, but if I send it to your pharmacy, the local pharmacy may not have electricity to access what I'm sending, and the phone lines might be down. There were so many things that I was like, I don't know how helpful this was, because I'm limited by electricity and technology issues, over there. So in some ways it's great because you're able to work with the family at the time with what they have at home and kind of help give them some guidance on, this is what I would do, this is where you are, how much oxygen do you have, do you need to go to the hospital because you have no power, things like that. But it's not a perfect system.
Yeah, that's very interesting. I've not run into that situation here in Colorado, but certainly challenging. But I'm sure that the patients were reassured to see you, Elise, and Elise chat with you to make sure that to calm them in a time of a lot of stress and make sure that they're doing okay. I think the only thing I would add for technology is now that there's variations of satellite phones and everything like that, and I know that's an extra cost, but certainly if you're living in a more remote area or somewhere that, does lose electricity and whatnot, that's another thing to consider having in times of emergency in case you do need to call for more assistance.
Elise, as you were talking, and I'm thinking about Jess in your area, you talked about wildfires earlier and snowstorms. Are there any special considerations or things to think about for patients within those environments to have to navigate or deal with?
Yeah, wildfires, the fumes, the smoke can travel pretty far. Like I know a couple years ago, again, there was significant wildfires in Oregon, and my family lives in Ohio, and they had poor air quality. And so Colorado, certainly mostly towards the end of summer, mid to end of summer, we get, and all along the Rocky Mountain Range, we have poor air quality. And so we certainly advise patients to maybe stay inside because if they have any sort of reactive airways disease, certainly that could be worse during that time. It also can make breathing a lot harder. They're on like our phone apps, a lot of the weather apps, they have a grading for air quality down there, and that's based on someone with healthy lungs and gives you recommendations. A lot of times it also elaborates too on if you have any sort of lung disease to stay indoors. So watching for the air quality, and like I said, I know like I have an iPhone, it says it on the bottom of the iPhone. Yeah. So those are certainly things to keep in mind with the wildfires across the country. And like I said, trying to stay inside a little bit more and avoiding exposing yourself to poor air quality, regardless of the cause. And then for snowstorms, I think the big thing is we don't have, at least our center, the pediatric side of things, we don't have a ton of patients that are up super high in the mountains, but we do. And we certainly have patients that live more remote, either in the southwest corner of Colorado, or they live in Wyoming, Montana, New Mexico, and some more remote areas. And with snowstorms, certainly power outages can happen when they're significant, or you are getting stuck and not able to leave your home for periods of time, because in the winter we just get pounded by snow, specifically up in the mountains. And I think to everything we've been talking about, being prepared, keeping an eye on the weather, that really does make a difference. And then making sure you have enough medication, especially if you live in remote areas, wherever you are in the country, if you're hitting that 7-day mark and you're ordering your medications and staying on top of that. And then I've mentioned a generator a couple of times. I know, again, that's expensive. I know that there are some reimbursements, sometimes through your state and local governments, and then online. So that's something to look into, especially if you're in areas where you get snowstorms and power outages and you're not needed to evacuate because of flooding, winds, and things like that.
I think temperature stability of the meds are also important to consider. I don't know that Colorado gets as cold as for Modulin, but in Houston, we definitely exceed the heat for Remodulin. And so we have some patients that need ice packs and coolers, things like that for their medicines as well. So yeah, that's just another point.
We certainly can have some temperature extremes as well. Not as hot as Houston by any means, but we get some hot days. So I think in general, not leaving your medications in the car, especially when you're on the ends of the extreme, even if you're just going in to run an errand in the store and everything, that car can get pretty hot or pretty cold quite quickly. And so I think to Elise's point is making sure that you keep your meds stored appropriately and prevent the breakdown of the meds. We want them working and not causing you any harm.
Perfect point to close on. I know we've talked about a lot in this episode, from emergency kits to having a plan. Any other last takeaways that you wanted to share before we end the day?
I think this whole podcast was about preparation, and I think the way we ended our conference presentation, we ended with a quote from Benjamin Franklin, which was, by failing to prepare, you are preparing to fail. So if you are setting yourself up for success at the beginning, it's going to be hard to be successful at the end.
That's really powerful. Thank you for sharing that, Elise. Jess, anything else to add to that?
No, but I think that's a great quote to end on.
Well, thank you both for being here and sharing your expertise. They shared this at conference. It was so well received. We had to bring it to the podcast. Again, don't wait. Start your emergency preparation plan today. And you can look for the link to resources in the description of this episode, as well as on PHA's website. So check those out on our website, and we will chat next time. And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. Thank you to our platform sponsor, J&J, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content.